Many men start noticing their urinary stream has become noticeably weaker, find themselves waking up 3, 4, or even 5 times every night to urinate, and realize that something fundamental has changed in their prostate health and urinary function. These changes happen gradually over months and years, but eventually they reach a point where they cannot be ignored anymore because they are affecting sleep quality, work productivity, confidence in social situations, and overall quality of life. The most discouraging thing I hear from men in my practice is the belief that there is nothing they can do about prostate enlargement except accept it or eventually take medication or have surgery. This sense of helplessness and resignation is completely unnecessary because scientific research clearly shows that specific types of physical exercise can genuinely improve urinary flow, reduce prostatic swelling, and significantly relieve symptoms without any medication or intervention. Today I am going to show you exactly which exercises have proven effects on prostate health and urinary function, and I am going to explain the biological mechanisms for why they work so you understand that this is not wishful thinking or pseudoscience. This is evidence-based medicine that you can implement starting today with nothing more than your own body and a commitment to consistent practice. My name is Dr. Isabel Lopez, and I am a urologist who specializes in helping men understand that movement and exercise can be real tools for prevention and improvement of prostate symptoms. I want to know where you are watching from today. Drop your city or country in the comments below. And make sure to follow this channel because I am dedicated to giving you practical strategies backed by urology science. Let me show you how to use exercise as medicine for your prostate. Before we discuss specific exercises, you need to understand what benign prostatic hyperplasia is and exactly how physical movement affects this condition. BPH is the natural enlargement of the prostate gland that occurs with aging, particularly after age 50, driven by hormonal changes and chronic inflammation. The enlarged prostate presses against the urethra and bladder, creating mechanical obstruction that makes it difficult to urinate fully and creates symptoms like weak stream, hesitancy, frequency, and urgency. The critical insight is that the problem is not just about the physical size of the prostate. It is also about the degree of inflammation in the tissue, the amount of congestion and poor circulation in the pelvic region, the tone and strength of the muscles surrounding the bladder and prostate, and the overall metabolic and hormonal environment in your body. All of these factors are modifiable through specific types of exercise, which is why physical activity is not just general health advice but a targeted therapeutic intervention. Stick with me until the end because I am going to give you a complete exercise protocol that addresses all aspects of prostate health. Exercise works through multiple mechanisms. It improves blood flow and lymphatic drainage in the pelvic region, which reduces congestion and inflammation. It strengthens the pelvic floor muscles that support bladder control. It reduces systemic inflammation throughout your body. It improves insulin sensitivity and hormone balance. And it helps maintain healthy body weight, which is critically important because obesity accelerates prostate growth. The beautiful thing about exercise as medicine is that it addresses root causes rather than just masking symptoms. When you strengthen your pelvic floor, improve your circulation, reduce inflammation, and optimize your hormones through consistent physical activity, you are creating an internal environment where your prostate can function better and symptoms naturally improve. This is not a quick fix, but it is a sustainable solution that gets better the longer you maintain it. The first and most important type of exercise for prostate health is pelvic floor muscle training, commonly known as Kegel exercises for men. These exercises specifically strengthen the muscles that support your bladder and prostate, and they have been proven in multiple clinical studies to improve urinary control, reduce post-void dribbling, and decrease urgency in men with benign prostatic hyperplasia. This is not speculation. This is documented medical evidence from controlled trials. The pelvic floor muscles form a hammock-like structure at the base of your pelvis that supports your bladder, prostate, and rectum. When these muscles are weak, you have less control over urination and more problems with leakage and urgency. When these muscles are strong and well coordinated, they provide better support, better control, and better function. Strengthening them through targeted exercise directly improves your ability to start and stop urination, reduces the feeling of incomplete emptying, and minimizes the embarrassing dribbling that happens after you think you are finished. The correct technique for pelvic floor exercises is to contract the muscles you would use to stop your urine stream mid-flow or to prevent passing gas. You should feel a lifting and tightening sensation in your pelvic region without tightening your abdomen, buttocks, or thighs. Contract those muscles firmly. Hold for 5 seconds while breathing normally, then relax completely for 5 seconds. This is 1 repetition. Start with 10 repetitions per session and do this 2 to 3 times per day. The key to success with pelvic floor exercises is consistency and proper technique. Many men squeeze the wrong muscles or hold their breath, which reduces effectiveness. Practice in front of a mirror initially to make sure you are not clenching your buttocks or abdomen. You can do these exercises anywhere, while sitting at your desk, driving your car, or watching television, because no one can tell you are doing them. Within 4 to 6 weeks of daily practice, most men notice measurable improvements in urinary control and symptom severity. The second critical type of exercise for prostate health is regular aerobic activity, and the simplest and most accessible form is walking for 30 minutes daily at a moderate pace. Walking improves blood flow throughout your entire body, including your pelvic region, and better circulation means more oxygen and nutrients delivered to prostate tissue and more efficient removal of inflammatory waste products that accumulate in enlarged prostate tissue. Multiple large population studies have consistently shown that physically active men have significantly lower rates of benign prostatic hyperplasia and substantially fewer urinary symptoms compared to sedentary men. The difference is not small. Men who engage in regular moderate aerobic activity have up to 25% lower risk of developing symptomatic BPH. This protective effect occurs through several mechanisms, including reduced systemic inflammation, improved insulin sensitivity, better hormone balance, and maintenance of healthy body weight. Constant movement throughout the day also prevents the pelvic congestion that occurs when you sit for long periods without moving. When you sit for hours, blood flow and lymphatic drainage in your pelvis slow dramatically, allowing inflammatory compounds to accumulate and creating the swollen, congested feeling that many men with prostate issues experience. Regular walking breaks up this pattern and keeps circulation active, which reduces both inflammation and the sensation of pelvic pressure. Beyond walking, other forms of moderate aerobic exercise like swimming, cycling, or using an elliptical machine provide similar benefits. The key is consistency and moderate intensity rather than occasional intense workouts. Aim for at least 30 minutes of aerobic activity most days of the week. If you cannot do 30 minutes continuously, break it into 2 or 3 shorter sessions throughout the day. The cumulative effect of regular movement on inflammation, circulation, hormone balance, and weight control creates a dramatically healthier environment for your prostate. Before we dive in, I want to share something special with you. I have created a 21-day challenge designed to help reduce and prevent prostate enlargement with simple exercises you can do in less than 15 minutes a day. Do not wait. Grab your copy of the ebook right now. The link is pinned at the very top of the comments. The third essential component of an exercise program for prostate health is regular stretching and mobility work focused on your hips, lower back, and inner thighs. Tightness and tension in these areas restricts blood flow to your pelvic region, creates mechanical pressure on your bladder and prostate, and contributes to the discomfort and urgency that many men experience with prostate enlargement. Improving flexibility and mobility in these key areas reduces pelvic tension and significantly improves comfort during urination. Simple stretching exercises and basic yoga poses are remarkably effective for this purpose. The butterfly stretch, where you sit with the soles of your feet together and gently press your knees toward the floor, opens your hips and increases circulation to your pelvic region. The bridge pose, where you lie on your back with knees bent and lift your hips off the ground, strengthens your lower back and glutes while improving pelvic alignment and blood flow. Hip flexor stretches and gentle spinal twists release tension that accumulates from sitting and improve overall pelvic mobility. A more flexible and mobile body maintains better circulation and less congestion in the prostate area. Tight muscles compress blood vessels and lymphatic channels, reducing flow and allowing inflammatory substances to build up. When you regularly stretch and move through full ranges of motion, you keep these pathways open and functional. Many men report that they feel immediate relief in their pelvic pressure and urinary comfort after just 10 minutes of targeted stretching. Dedicate 10 to 15 minutes daily to stretching and mobility work, ideally in the morning to start your day or in the evening to release accumulated tension before bed. Focus on hip openers, lower back stretches, and gentle twists. If you are new to stretching or yoga, start with basic movements and gradually increase range and duration. You do not need to be flexible to benefit. The act of working toward better mobility is what creates the improvements in circulation and comfort. The fourth component of a comprehensive exercise program for prostate health is regular strength training or resistance exercise, which provides benefits that go far beyond just building muscle. Light to moderate strength training using bodyweight exercises, resistance bands, or weights improves insulin sensitivity, which is critically important because insulin resistance and metabolic syndrome are major risk factors for accelerated prostate growth and worse urinary symptoms. Men who maintain good muscle mass and lower levels of abdominal fat have significantly better hormonal profiles, including higher testosterone, lower estrogen, and better overall hormone balance. Muscle tissue is metabolically active and helps regulate blood sugar, burn abdominal fat, and maintain healthy hormone production. In contrast, excess body fat, particularly visceral fat around your abdomen, produces inflammatory compounds and converts testosterone into estrogen through the aromatase enzyme, creating exactly the hormonal environment that promotes prostate enlargement. Regular strength training 2 to 3 times per week using major muscle groups like legs, chest, back, and core provides these metabolic and hormonal benefits while also improving overall functional strength and independence as you age. You do not need heavy weights or intense bodybuilding routines. Simple exercises like squats, push-ups, rows, and planks performed with proper form and moderate resistance are sufficient to create meaningful improvements in body composition, insulin sensitivity, and hormone balance. The combination of strength training with the aerobic exercise and pelvic floor work we discussed earlier creates a synergistic effect that addresses prostate health from multiple angles simultaneously. You improve muscle strength and urinary control, enhance circulation and reduce inflammation, optimize hormones and metabolism, and maintain healthy body weight. This comprehensive approach is far more effective than any single intervention and creates sustainable long-term improvements rather than temporary symptom relief. Join the Members Club. Drop a super like if this video has shown you that you have real power to improve your prostate health through movement, and share this with any man over 50 who needs to know that exercise is medicine for the prostate. Let me bring everything together with the most important message. There is no immediate cure or instant fix for prostate enlargement, but there absolutely is real and continuous improvement that comes from doing the right types of movement consistently over time. The exercises I have described today, pelvic floor strengthening, regular walking or aerobic activity, stretching and mobility work, and basic strength training, are not random recommendations. They are evidence-based interventions that address the specific mechanisms driving prostate enlargement and urinary symptoms. When you practice these exercises consistently, your body responds by improving circulation, reducing inflammation, strengthening supportive muscles, optimizing hormones, and creating an internal environment where your prostate can function better. Consistency is what makes your body respond and creates lasting change. One day of exercise does nothing. 1 week creates minimal change. But 3 months of daily pelvic floor exercises, regular walking, stretching, and twice weekly strength training creates measurable improvements in urinary flow, symptom severity, and quality of life that you can feel and that show up on objective testing. Every walk, every stretch, every pelvic floor contraction is an investment in your health that compounds over time. Taking care of your prostate through consistent movement is taking care of your energy, your self-esteem, your confidence, your independence, and your freedom to live without the constant limitations and embarrassments that come with urinary dysfunction. Movement truly is the best medicine, and the power to improve your situation is completely within your control. Start today with pelvic floor exercises and a 30-minute walk. Add stretching tomorrow. Build strength training into your weekly routine. Be consistent, be patient, and trust that your body will respond. Your prostate and your future self will thank you for the commitment you make today.